Welcome back, everybody. You've heard of laugh lines, but how about leg lines? That's right. Today in the Sandwich Generation, what your veins say about your health. And here to explain is Dr. Joseph Karam. He is a vascular surgeon with the Minneapolis Heart Institute and Allina Health. Thanks for being here.
Thank you for having me.
Let's just begin by talking about the overall importance of healthy veins.
Well, healthy veins means, healthy legs and a healthy lifestyle. Having healthy legs entails somebody who exercises or takes care of his legs, prolonged activities of standing, wearing compression stockings to prevent varicose veins from happening. So healthy veins, healthy legs means a happy person.
Lots of standing.
Correct.
Okay, I'm going to come back to that. Let's talk a little bit about what is varicose.
So varicose veins are veins that are enlarged or swollen that appear because of overfilling of blood that happens in the legs. It affects people in their...
So kind of like we're seeing on this picture?
Correct. People in their 40s and 50s are mostly affected. Women more than men. Varicose veins basically are on the spectrum with spider veins that we can talk about too. Basically, they're veins that are either superficial or deep, and it really depends on how thin the vein is or how deep it is to call it a varicose vein or a spider vein.
So what would you call a spider vein?
So spider veins are very superficial, tiny little veins that live real close to the skin. They're typically little ropey veins that we can see here that are much smaller than varicose veins, but they can be just as symptomatic.
Is that the only difference between the two, or
it's
are there other
depth and how they look and how thin the vessels are, but they're along the same spectrum.
Okay, so we see a comparison here.
Correct.
On the left, varicose
veins
and,
and some spider veins there.
What causes them?
So a lot of times the reason for these veins to cause problems is, if we think about the basic concept of how veins work, they work against gravity, bringing blood back up to the heart. So you have to have a healthy pump, which is the muscles of the legs that push the blood back up to the heart. You have to have open veins, so no clots in there in order to have that. And more importantly, valves that prevent that blood from pooling back down because of gravity.
Are certain people at risk?
Women are more at risk than men. Hormonal changes associated with pregnancy as well as menopausal changes can cause these veins to lose their elasticity and become a little bit more prone to having this engorgement. People who stand a lot and do a lot of standing activities, people who don't exercise much, who keep their legs down, even in an office setting without wearing compression stockings, are a little bit more at risk. Obesity is also a risk factor.
So ladies, go grab some compression stockings. They're the best.
Absolutely.
And just wondering, can these veins, varicose veins, be a sign of bigger health issues?
So it's important to know that varicose veins per se are not dangerous, but we need to know why they're there. And seeing a specialist for that with getting the proper ultrasound and diagnosing the issue is important, because then we can find out what's going on there.
Okay. Thank you so much for stopping by.
My pleasure.
On this holiday. And if you want to review today's vein health information, just head over to KARE11.com. You'll find us under the shows tab on our homepage. And of course, even on the 4th of July, we've got this weekly reminder for you. For information on a wide variety of aging-related topics, just call the Minnesota Board on Aging's Senior Linkage Line. Experts are on hand to answer your questions. Weekdays, 8 a.m. to 4:30 p.m. That number, 1-800-333-2433.